Now we will explore syphilis titers in more detail. By the end of this lesson, you should be able to describe what each number in a titer means. You should also be able to explain how titers are used to detect signs of reinfection and treatment response. You will also be able to read a titer chart and determine how many dilution changes have occurred between two titers. You should also be able to describe other factors that can contribute changes in titer. Finally, you will be able to describe the factors that can contribute to treatment failure. When running a non-treponemal test, like a VDRL or an RPR, the first step in testing will generate a qualitative result, reactive or non-reactive. If reactive, the laboratory can run a titer on that sample to determine how much bacteria are present. The titer test will generate a quantitative result, which is a series of numbers that you see on this slide. The value of the titer can then be used to check for things like reinfection or response to treatment. A quick note on reading titers. The colon between the two numbers of the titer should be read as 2, so this titer would be read aloud as 1 to 1. The first number in the titer represents the portion of the sample that is being diluted, in this case red, and the second number in the titer indicates the proportion of diluent is being used to thin the sample, in this case white. So again, for every 1 drop of red, we're adding 1 drop of white. Thus, we are running a 1-to-1 titer. A laboratorian runs a titer that are slowly diluting or thinning out a sample, usually blood, until bacteria can no longer be detected. To demonstrate this, let's take the colors red and white. If we want to dilute the red color by running a 1-to-1 titer, for every 1 drop of red, we are going to add 1 drop of white, resulting in a soft pink color. Now let's compare a 1-to-1 titer to a 1-to-16 titer. A 1-to-16 titer means that for every 1 drop of red, we are going to add 16 drops of white. Notice how the red becomes much fainter or more diluted. This makes it much harder to generate a reactive result on a sample with a lower concentration of bacteria. The final titer result reported by the laboratory represents the highest level of dilution that can still trigger a reactive result. If you're still picking up a bacteria after heavily diluting a sample, this is an indication that someone has a lot of bacteria in their system and they're likely in an earlier stage of infection. Unfortunately, you cannot stage someone as an early case based on their titer, but you still want to prioritize persons with a high titer for partner investigations. As demonstrated with the color example, a larger number after the colon indicates a higher titer, thus more bacteria present in the sample. So if someone has a 1-to-1 titer or a 1-to-2 titer in June, but by August they have a titer of 1-to-16, their titer has increased, and we would be concerned that they have been recently infected or reinfected. Similarly, if the number after the colon is smaller over time, that is a sign that a titer is dropping, i.e., there is less bacteria in the sample. So if a titer is 1-to-64 in June, but drops to 1-to-4 by October, that is a sign that maybe they received treatment and are having an appropriate treatment response. Keep in mind that titers can and do drop even without treatment. The number to the left of the colon will always be 1. Now take a look at the number to the right of the colon. What patterns do you see in how the number to the right of the colon changes as you move to the right of the titer chart? You might notice that with each step to the right, the number to the right of the colon doubles. With dilution, you are gradually doubling the amount of diluent used to thin the sample. Look at the titer in the first purple block. Remember that the number to the left of the colon never changes because it represents the sample you are diluting. The number to the right of the colon will increase because it represents the diluent. Since you are gradually doubling the amount of diluent to the sample, this number will double with every step in titration. Since the number to the right of the colon in the purple box is 1, you multiply 1 by 2 to get the next titer in the sequence. 1 times 2 is 2, so the next titer in the blue box is 1-to-2. To get the third titer in the sequence, you double the 2 from the 1-to-2 titer, and you get a 1-to-4 titer. When you double the 1-to-4 titer, you get a 1-to-8. When you double the 1 to 8, you get a 1 to 16, and the pattern continues until you no longer have a reactive titer. If you know this rule, you will be able to write out the titer in sequence from memory without having to use this chart. You will also be able to determine how many dilutions have occurred, which is important for determining whether someone has been reinfected. You may want to keep a titer chart on hand as you start practicing reading titers. If someone moves up by 1 dilution, 1 step to the right on this chart, we consider that to be within range of error for a test, and they would not meet the definition for reinfection. This 1 dilution increase may also be referred to as a twofold increase, since each dilution represents a doubling of the diluent used, as discussed in the previous slides. If someone moves 2 spaces to the right on the titer chart, this is considered a 2 dilution or 4-fold increase. Moving up 2 dilution steps means quadruple the amount of diluent was used. If a titer increases by 2 dilutions, i.e. 4-fold, this would meet the definition of reinfection. We also use titers to gauge treatment response. We typically like to see at least a 4-fold drop in titer following appropriate treatment. However, it can take 6 to 12 months to observe a 4-fold drop in titer following appropriate treatment, and persons with a day of treatment titer of 1 to 8 or less are less likely to observe a 4-fold drop in that time. Titers can fluctuate, especially during pregnancy, so we're really looking for a sustained 4-fold increase when we're monitoring for reinfection. If you see someone jumping from a 1 to 4 to a 1 to 6, then back to a 1 to 8 without initiating treatment, we would consider them to still be within the plus minus 1 dilution range, and we would not consider them reinfected. We also see titers increasing a bit with age, and we tend to see persons co-infected with HIV hanging out at higher titers. Though a high or quickly rising titer is often indicative of a recent infection, you cannot stage a case based on titer. You definitely want to prioritize those cases for partner services, but you may have to close them out as latent cases if you can't prove that they meet the case definition for an earlier stage. We'll explore staging in more detail later. Now let's work through a scenario. A patient comes in on January 1st with a titer of 1 to 64 and a reactive confirmatory test. They meet the case definition for syphilis, and the provider has diagnosed them with latent syphilis and treated them with 3 doses of bicillin at 1-week intervals. The first dose is administered on January 25th. It is now August 1st, and the titer has not dropped. It's still 1 to 64. Why hasn't the titer dropped? There are definitely a lot of things that could impact titers. One of the big issues with this scenario on the slide is that the provider failed to run a day of treatment titer, so it makes it very difficult to determine if the titer has actually dropped. If the case was early in their infection, the titer could have easily increased between the time that the patient was tested and the time that they initiated appropriate treatment. Other considerations for this case is that it has only been a little over 6 months since treatment was initiated. It can take 6 to 12 months to observe a 4-fold drop in titer, so we still have time to observe an appropriate treatment response. We've already established that a sustained 4-fold increase in titer is one indicator of reinfection. Recurring signs and symptoms after treatment would be another indicator that someone has been reinfected. Reinfection means that you've got more partners out there that have not been successfully linked to care and treatment, so you will need to do a re-interview. While penicillin, brand name bicillin, is the preferred treatment for syphilis, some patients may receive doxycycline. The trouble with using doxycycline for syphilis is that it requires patients to take it twice a day for a period of 2 to 4 weeks. Doxycycline can have some nasty side effects, and remembering to take the medication daily for up to a month can be difficult. Similarly, some patients do not have safe places to store their medication. If the patient does not complete the full course of treatment, they may not clear the infection. If the person received treatment for late latent syphilis, you will want to check that the doses were administered at the appropriate intervals. Late latent cases need to be treated at 1-week intervals. We do give a little bit of wiggle room in the case definition, and we'll cover this later, but the optimal spacing is 7 days between doses. The weekly injections are needed to sustain high enough levels of penicillin to kill off the syphilis bacterium. Another factor contributing to treatment failure is the incorrect of bicillin CR over bicillin LA. The LA in bicillin LA stands for long-acting. We use bicillin LA to treat syphilis because we need the penicillin to hang out in the bloodstream for a long enough time to kill syphilis bacterium. Bicillin LA stays in your system longer than bicillin CR and is more effective in clearing the infection. And the final potential cause of treatment failure that we will discuss in this module is unrecognized signs of central nervous system, or CNS involvement. Once it invades your CNS, syphilis can wreak havoc on your vision, your hearing, your brain, and the bicillin injections will not be enough to clear the infection. The good news is that these forms of syphilis can be treated, but the recommended treatment is aqueous penicillin by IV for 10 to 14 days. Let's explain another scenario. Say you have a person with primary syphilis who fails to have an appropriate fourfold drop in titer within 12 months of receiving appropriate treatment. They do not have signs of reinfection. Are we concerned about treatment failure? And what should you do? Yes, this could be a sign of treatment failure. Keep in mind, clinical evidence suggests 10 to 20% of primary secondary cases will not achieve the fourfold decrease in 12 months. Titers less than 1 to 8 are also less likely to drop fourfold than higher titers. If you do suspect treatment failure, like in the previous scenario, the recommendation would be to perform a neurological exam to check for CNS involvement. If the follow-up cannot be performed, then retreatment is recommended since it has been more than 12 months since the infection. The patient would need 3 weekly doses of bicillin, assuming no evidence of CNS involvement. It is also recommended that persons with signs of treatment failure received clinical and serological follow-up annually and reevaluation for HIV. Please check out the 20 to 21 STI treatment guidelines for more information on treatment recommendations. Even years after successful treatment, a patient may remain reactive on both confirmatory and non-confirmatory tests for syphilis. A reactive titer does not mean that a person had treatment failure or that they still have syphilis in their system. Syphilis tests are nonspecific. For this reason, it is the change in titer that we look for when we are evaluating for infection, reinfection, and treatment response. In this lesson, we outlined what each number in a titer represents. We covered how a fourfold or 2 dilution increase in titer is a sign of reinfection, and that dropping fourfold in titer following appropriate treatment is a sign that a case has had an appropriate treatment response. You should now be able to read a titer chart and determine whether a fourfold increase or decrease has occurred. You should also be able to identify other factors like age and pregnancy status that can use titers to fluctuate. Finally, you should be able to navigate next steps in a patient that is showing signs of treatment failure, i.e. a titer that is not dropping, and describe the value of collecting day of treatment titer.